Okay, so this next segment is going to be looking at what's deemed the indirect acting muscarinic receptor agonist, or sometimes called, more often called, acetylcholinesterase inhibitors, and sometimes called anticholinesterases. And so you can kind of subdivide them based on some of their kinetics. And the most useful drugs are the reversible drugs, and so neostigmine, physostigmine, adrefonium, and the reversible aspect occurs because the hydrolysis step on the enzyme occurs at a slower rate. The irreversible drugs have minimal to no therapeutic effect or therapeutic use. They have great effects. Most of these drugs are toxins or poisons, and there's a very interesting history about them, which we'll talk about in detail. And they're, from a kinetic profile, they're irreversible because hydrolysis doesn't really occur, and if it does occur, it happens very, very slowly, and in fact, so slowly, usually the patient dies before the drug gets disengaged from the enzyme. And so acetylcholinesterase inhibitors have like 3 different domains, and you don't need to know this. This is just more from an understanding. But based on where these drugs bind, kind of relates to some of their clinical or their physiologic effects. So there's reversible short-acting anticholinesterases, which have a specific use. There's carbamylating agents, which are of intermediate duration, and these are also reversible. And then there's phosphorylating agents, which are more often long duration inhibitors of acetylcholinesterase, and those have really minimal therapeutic uses. And so just to kind of take a break for a second, we're going to quickly summarize the neuromuscular junction. And of course, I'm sure neurology and physiology and perhaps even anatomy has kind of gone into some of the detail in terms of the neuromuscular junction. But essentially, what we're looking at is a nerve that controls muscle movement. Okay, and it does so by releasing acetylcholine, which hits the motor end plate here, which has these nicotinic sub-M receptors, or the NMJ receptors, and that allows for sustained voluntary muscle contraction. All right, and so the indirect acting cholinomimetics or acetylcholinesterase inhibitors can be classified also based on their chemistry. The alcohols tend to be the shorter acting drugs, such as adrefonium. These are competitive, of course, and reversible, which is good. The carbamates, such as neostigmine and physostigmine, tend to be a little bit longer in terms of their duration of activity, and they're processed like acetylcholine, but that second step that involves how this drug kind of interacts with the enzyme takes a lot longer. So that's why these are clinically useful. The organophosphates, which is a chemical class of drugs that are basically poisons, these have really long bindings to the enzyme, and in some cases are irreversible. They bind forever. More often, the patient dies before the enzyme ever disengages from the drug. And so, kind of the disease that we always usually kind of discuss with these drugs is myasthenia gravis. And so let's take a break here, and our next video will just solely be on myasthenia gravis. We'll just call this the introduction to cholinesterase inhibitors. Okay.